Welcome to my presentation, which is an educational assessment strategy which involves nursing students in promoting health and well-being. A little bit of a background about myself. I'm a mental health nurse. I'm a PhD candidate. I'm a lecturer and a professional lead in the mental health field at Keele University. The assessment strategy had two components to it. It had a peer assessment and a group presentation. So the task was a 15-minute oral group presentation with 5 minutes for questions at the end. And the focus was on health promotion and prevention in a defined population. So the aims of the assessment were to improve knowledge on public health needs of different communities, to engage students in health promotion and prevention of ill health, to meet the future nursing standards for proficiency for registered nurses, and this is the platform 2, which is promoting health and preventing ill health. According to World Health Organization, health promotion can be defined as the process of enabling people to increase control over and to improve their health. And I'm sure you agree with me that health and well-being is fundamental to quality of life and is an essential component of any society. Therefore, it is important for us to encourage nursing students to be involved in promotion of health and well-being, and this should also include promotion of mental health and well-being. And it's also important for them to understand the impact of people's lifestyle on health, and more so at this time, at this current climate, where obesity is a biggest problem, and smoking is also a challenge. And also, it's important for them to understand that nurses play an important role in reducing health inequalities in communities. So as part of the assessment, there was a guidance which guided students to choose a public health issue and analyze its extent to a defined population of their choice. And they were required to suggest a health promotion strategy or intervention which will address the issue. This was to be based on evidence, and the group said to suggest how the intervention or strategy could be evaluated. And students could choose any population within the United Kingdom and compared the public health issue to Stoke-on-Trent, which is where the university is based, and to the national and global picture. There were some public health issues which were identified by the students. These included smoking, obesity, suicide, sexual health, mental health, child dental health, and one interesting one was air pollution, where one group looked at air pollution in London, and they calculated the carbon emission there and compared it to Stoke-on-Trent. And other topics included alcohol misuse, substance misuse, cervical screening, but I'm sure in this current climate, COVID-19 would definitely be one of the public health issue. So for the participants, these were all year 2 nursing students from 4 fields of nursing, and this included adult students, mental health, child and learning disabilities. And students were divided into groups of 6, and they were made aware of their group members at the start of the module. So for the components of the assessment, like I've already said, that there was a peer assessment and a group presentation. So students had to assess each other on engagement, on how they engaged with the process, and this was done collectively. So students had to meet and agree on a mark, and this was worth 10% of the overall mark. And this peer assessment was to be submitted prior to the presentation day. So for the criteria for peer assessment, the students marked each other whether each individual attends group meetings regularly and arrives on time, contributes meaningfully to group discussions, completes group work in a quality and timely manner, demonstrates a cooperative and supportive attitude, and contributes equally to the success of the project. So all these components had 2 points each, and this totaled to 10. So I've got an exemplar here, but it's not very clear, but uh, if anyone needs it, I'm happy to email it to them. And for the other component of the assessment, which was the group presentation, so a group mark of up to 90% was awarded to the product, to the whole product of the presentation by the assessors, and this assessed students on their organization of the presentation, their knowledge base, their literature, reflection on clinical practice, referencing, and syntax. Evaluation was done in two forms. This was through post-presentation questions and through an end of module evaluation. And for the post-presentation question, each group was asked what they'd learned from the group presentation process. And this elicited what the student had gained by going through the process. And further questions were on the Google form. For the outcome of the evaluations for both the post-presentation questions and end of module evaluation, students indicated skepticism at the beginning of the whole process, and they were worried about their degree classification being affected by others. Despite all this, they indicated that they enjoyed the presentations in the end, and also they identified that they gained knowledge on public health needs of different communities. For example, having an opportunity to study about air pollution in London is something that they wouldn't have had without this process, and it was also interesting to them to compare air pollution in London and to Stoke-on-Trent. And students also identify how their city's public health needs compared to other cities in the United Kingdom. They also revealed improved collaboration and teamwork among each other. They also revealed that the process actually helped them to engage in health promotion, and also it also improved their organizational and time management skills. So I've got some useful observations from myself. I found that having timetable sessions for the groups to meet was a positive thing. And the peer assessment part of the assessment enhanced participation because all students wanted to score higher on the peer assessment. And I found that the groups which met regularly did very well in the presentation. So despite having some timetable sessions, students did meet outside these, and they practiced their presentations, and this was reflected in the marks that they gained. And also, encouraging group members to help each other during the presentation fostered a sense of cohesion. So the students understood that the task was a group task, therefore they had the opportunity to help each other for them to succeed. So they did that, and I found that was another positive thing. And also, having lesson students from different fields enabled sharing of knowledge, and it widened focus. So this was one of the things students actually enjoyed working together despite coming from different fields of nursing. So for implications for practice, I'll say this assessment strategy can be successfully used to educate nursing students to understand health needs of their local community and explore possible health promotion strategies. And peer assessments can empower students and enhance important nursing skills. So these are my references. And if you do have any questions, I'm happy to share or answer your questions if you use the email attached. This is the end of my 10-minute presentation. Many thanks.